नमस्कार, मैं हूं डॉक्टर मनीष सिंघल, मेडिकल ऑन्कोलॉजिस्ट, अपोलो हॉस्पिटल्स नोएडा एंड दिल्ली से। आज हम बात कर रहे हैं, इज इट पॉसिबल टू डायग्नोज कैंसर 7 years ahead of time? Yes, there are new tests which are coming up and giving the promise that you can actually diagnose cancer many years before you actually diagnose it on a CT scan or a PET CT scan or on a biopsy. The only worry of these tests is that if they diagnose cancer, if they tell that yes, you are at risk of diagnosing or getting diagnosed with cancer, what do you do 7 years before? That algorithm or that protocol is not yet set. So even if you were to diagnose or if you were to know that you are likely to develop cancer, we have to know what is the modus operandi after that. What do you do with that information? Do you live in fear and spoil the rest of your life? And how robust is the data? So these studies have been done by studying the blood samples of patients who developed cancer or who did not develop cancer, or who had cancer and they were blinded to know whether they have which type of cancer or not. And they could find the certain proteomics and certain proteins and genes in the blood of such patients where that was very specific to the diagnosis that they had. These studies were done blinding the person who did the blood test of knowing that which type of cancers these patients were suffering from. So there was very high specificity and sensitivity. But there are ethical issues around doing such tests without the information of what exactly needs to be done medically during this waiting period of 7 years. Because the very premise of diagnosing cancer is through a biopsy and a PET CT scan. We have not yet risen from there of how to diagnose cancer, of what to do without a proper gold standard diagnosis of cancer, which still remains biopsy and scans. Well, whenever we have discussed this from such companies who are trying to develop such tests, they are quite silent on what this information would mean to that patient and what would be the treatment algorithm from thereof. So I think before we fire those guns, we must wait, understand what these tests promise us and what we are supposed to do, and develop such algorithms so that the right advice can be given. It's not just about doing the test and having an information, but it's also about what we need to do after that information and how we can get better from that information is something that needs to be done. I think the onus of this also lies with the developers of the test. Before that, I think this test should not hit the market for anybody and for everybody. Thank you.